Good evening, everyone. Welcome to the Siddha-Vetha webinar series. Today we have a well-known, profound scholar. Most of you probably know him. He is from India. Everybody knows in India at least. And he is no one but Dr. B.M. Hegde, who has so many degrees, MD, FRCP, whatever you name it. So the doctor has so many years of experience as a medical doctor. He was born professor. He started teaching in a medical school in his 23rd year, and still sometimes when he goes back, he is able to, when he finds time, he teaches. Starting as just a normal tutor, he was able to become the vice chancellor of a well-known famous university in India. It is the Manipal University, and he is one of the rare Indians appointed as the visiting professor of cardiology at the Middlesex Hospital Medical School, University of London, way back in 1982. Was also the first Indian teacher to examine the Royal College. You know, Royal College is one of the famous colleges. Final examination, he was an examiner both in the UK and Ireland. So he is a revolutionary researcher of the reputative variety. Probably you have seen him or heard his YouTube lectures. He published all of this scientifically in UK, USA, Germany, Kuwait, China, in addition to India, most in literature form and videos. And a lot of people are like, they wanted to see him and meet him. It's a celebrity. So he has 35 or more books and running in thousands, both in English and Kannada. So everybody has, his book. So one of India's highest civilian awards, called the Padma Bhushan Award, was awarded to him in 2010. Dr. B.C. Roy National Award in the category of Eminent Medical Teacher, the highest medical award in India. And Dr. J.C. Bose Award for Research in Life Sciences, Distinguished Physician of Indian Award, and the Karnataka Rajya the award are one of very few of the awards that he is listed. There are so many awards that he got in the list. So his research organization, World Academy of Authentic Healing Sciences, with its journal, the Journal of the Science of Healing Outcomes, started with the world-renowned scientist, late Professor Rastam Roy, has been exists now for 12 years. The journal is running successfully. This scientifically authenticates simply common healing methods for the common good. The editorial board has some of the great scientific names, including Nobel laureates. Professor Hegde is also the co-chairman of the TAG VHS Diabetes Research Center, Chennai. He was talking about it, and I'm going to visit. This is like amazing thing that they are doing. And I discussed with him. Professor Hegde feels that inexpensive bedside medicine practiced by a compassionate doctor is the future of the healing sciences. So it's a very important thing that you want to mention. Inexpensive bedside medicine practiced by a compassionate doctor. That will be the future of healing medicine. Late Nani Palkivali, a great Indian jurist, used to call him a cardiologist with a heart. And is currently in the Siddha-Vetha advisory board member. Welcome, Doctor.
Thank you. Thank you, Shan.
Thank you. You can start, please.
Thank you very much. Good evening, all of you. We have not met, but we know each other, and we will know more frequently in future. because I'll be coming back again and again, like an old Arabic saying, an old coin put into circulation, it bounces back again and again. So I am an old coin put into circulation by Shan in this circle. Friends, today I am going to talk to you for the next 20 odd minutes about the common thing that you migrated Americans worry about, the food that you eat here, because you are worried, because there's so much of confusion in the Western science about the food that we eat, and what it should contain, how it should be, and what are the ingredients, etc., etc. So the science is not settled. As a matter of fact, I always say this is an imprecise science, the science of epidemiology. And the Western medicine has done very well in certain areas, especially in the control of communicable diseases, it has done well. But when it comes to non-communicable chronic diseases, Western medicine miserably has failed, or it's not adequate. So we need the buffering of some other system. And way back I wrote an article called How Might Ayurveda, the Indian great scientific medicine, help modern medicine in completing the sickness care delivery system of all illnesses in the future. This was very well taken by the scientific community. And today I am going to discuss only about the food part of it, because the food part is the most misunderstood part in the West. I'll give you a small gist, in a bird's eye view into it. You have heard so much about the fat theory that people thought fat was connected with heart disease. You would be surprised to know that there's no connection between what you eat and the heart disease, especially the fat content of it. But how did this come about? Because the sugar lobby was worried in the 50s when they found out that sugar is a bad ingredient in food. And sugar is really bad. But they wanted to put the blame on someone. So they paid some so-called, remember this, they paid some scientists to create a myth that probably fat is bad. So they created this. And the whole thing is based on one study, a large study by a man called Ansel Keys. Ansel Keys was an epidemiologist. Epidemiology is a imprecise science. And there's a saying, epidemiologists cause epidemics. And as a matter of fact, he has created an epidemic of fat. And this man, with his wife, who was a biochemist, got $110 million from the American taxpayers' money as grant. So he went around connecting the thing, and they went on a 22-country tour to study the epidemiology of heart disease. And they wanted to find out the relationship between food and heart, and the fat in diet and heart. And when they came back after 22 countries, they put their data together, and lo and behold, they were not matching. There was no straight line connection between the fat intake in food and the incidence of heart disease or death due to heart disease. So what did they do? They can't give a negative reply to their funders because next funding won't come. So they had to give a positive reply. This is what's being done in Western medical science. So they sat down and cut country by country by country by country. And after 22 countries, they cut 16 countries. And they're left with 6 or 7 countries where there was some sort of a relationship between the two. But mind you, this is only an association. Food intake of fat and heart disease were associated even in those 7 countries, not, but they converted this association into causality. They said fat is the cause of heart disease. And this is a very, very bad science. To convert association into causality is very bad. I was in London at that time, and we had a very interesting colleague of mine called Peter Taggart. And Peter did a study just to see. And what he did was he collected data on the number of trousers sold in Europe since Second World War, like the number of grams of fat taken in the food after Second World War. Because affluence came to Europe after the Second World War, and people had more money to buy, so they bought more things. And would you believe that the association with the number of trousers sold and heart disease was also more relevant than the amount of fat that take in the food? So he jokingly wrote an article saying that buying trousers and wearing them causes heart disease. So you can connect any two associations. When two things go up in society, a lot of things are associated with it. And when association becomes causality, it becomes ridiculous. So if you now understand, the whole thing was so ridiculous that this so-called fat has nothing whatsoever to do with heart disease. As a matter of fact, cholesterol is a part of our own body's creation. Our own liver produces cholesterol, and almost 80 to 90% of the cholesterol that you see in our blood comes from your own liver, and only 10 to 20% of the cholesterol comes from the food you take. So, but then if you now look at the Western science and common man's thinking, they are so worried about cholesterol that they think of cholesterol with even morsel they take the food, and that itself is a stress. In this context, I would like to remind you the holy science on the holistic science and the longitudinal studies of Indian science of Ayurveda. As a matter of fact, the Western science has got what's called the RCT as its background, randomized controlled trials. These are all short studies, maximum 6 months, and the longest was 5 years. And within that time, you don't get the real idea. Now listen to me. In the short study, they found there was a study called MRFIT study, multiple risk factor intervention trial, which went on for 5 years, and they found a lot of association between cause and effect. But when it went to 10 years, the whole thing reversed. When they continued to observe it for 25 years, they found none of the old things held any water. So the MRFIT study said there are no risk factors at all in the MRFIT study. So risk factor is an imagination. And even if you control the risk factor with all the drugs and surgery that you know, today we do that. If your sugar is up, we have a drug. If your blood pressure is up, we have another drug. All chemicals. So all this can only improve the risk factor, but the risk, if any, that ultimate risk remains. If supposing somebody has a risk for a stroke or a heart attack, even if you control his sugar and cholesterol and high blood pressure, the heart attack and the stroke will certainly come in spite of controlling the risk factors. So the MRFIT study said, in this study, there are no risk factors. So the cholesterol thing was blown off in the MRFIT study itself. But now we have another study which has gone on for 90 long years. This is a study of the alumni from Harvard University of the 1930s. And the study has been observing them for longevity and good health for the last 90 odd years. A lot of them have died, a few have survived. And what has come out in this study is something very interesting, very, very interesting. And what it showed was that only 3 things mattered for health and longevity. A, alcohol, which is the enemy of mankind. Though the short studies showed that alcohol is good for heart disease in some studies. This was funded by the alcohol industry. Now alcohol has been found to be very bad. Next thing that was found to be very bad was alcohol and tobacco smoking. So apart from alcohol and tobacco smoking, the only thing that determined your longevity and your good health is your capacity to love others, show compassion, and have a social contact and friends and relatives. Look after them. So 3 things came up. A, alcohol. B, tobacco. 3, love. And would you believe, this is exactly what Ayurveda has been saying for hundreds of years. And Ayurveda so beautifully says that food is not important. It is what you do and what you eat is important. How much you eat. So it says one small stanza which explains our lifestyle. One, it says, Hita Mita Ahara Sevi. Nitya Hita Mita Ahara Sevi. Eat food in moderation that you like. Remember that? It's very easy. The food that you like, eat in moderation. So it doesn't matter what you're eating. Now, for example, here, a lot of Americans I have seen are worried about ghee. The minute they see ghee, they say, oh, there's cholesterol in it. Would you believe that according to Ayurveda, ghee is the best food? Ghee is the food that gives you the best health. It says, Ghritam Tejasvevanam. The ghee is very good. Pitta Anila Haram. It removes all the bad things. Rasa Saujasam. Ojas. Ojas is the best health. So if you base your food on ghee, which we Indians do back home, not in here, I don't see anybody eating ghee. They shun ghee here. They're afraid of it, of the cholesterol, which is a bogey raised by Western medicine, of wrong science of Western medicine that I've shown you. Ansel case, 26 country study. And Ansel case, of course, got a lot of money. and he enjoyed his life. But the study that he gave was not a good study. But we still depend on that and say cholesterol is bad. And very thought that cholesterol is bad, and when you sit in your dining table and think of cholesterol, that stress itself will kill you faster than the cholesterol is. So the Indian message is Nitya Hita Mita Ahara Sevi. Eat in moderation what you like. But the word moderation is the key word. You should not overeat, which is very bad. Eat in moderation what you like. Samikshakari, the next word is work very hard, very hard. Hard work has not killed nobody, but laziness has killed. As a matter of fact, our ancestors used to work very hard and they were very healthy. And we should try to do that. We don't do that, and we don't eat like them. And if we also work very hard and eat as they did, we will also live like them, healthy and happy for a long time. Samikshakari. Then it says, Data, be a giver, not a taker. You see, taking from somebody is stressful. Supposing you give me 100,000 rupees, I would say, why has he not given 200,000? Why only 100,000? You know, I become more greedy. But if I'm able to give you 1 rupee, I'm so happy that, well, I have been able to give this man something. So be a data, be a giver. Samaha, treat everyone as equal. In society, what we do is, big people we bow down and small people we mistreat. That is very bad for your health. Samaha. Then Satyapara, don't be a liar. Be truthful, because truth is not stressful. Lie is stressful, because if I told you a lie today, I'll remember that for next time when we meet also I must repeat the same lie. So it's very stressful and it raises your blood pressure and spoils your health. But if I told you the truth, truth is universal. So it is the same every time. So I don't have to worry, I don't have to remember, it's not stressful at all. So Samaha Satyapara. Then the most important thing comes, Kshamavan. I may say I don't harm anybody, but somebody else might come and harm me. Then also I should have the courage to forgive. Forgiveness is the greatest asset for good health. And forgiveness is, it's not cowardice. Forgiveness is courage. To forgive someone else who has harmed you, it requires a lot of courage on your part. And forgiveness is the greatest asset for health. And forgiveness improves your health and your longevity. Kshamavan. Then it says the most important thing, Apto pasevi bhavet arogyam. Treat everyone as your near and dear ones. Treat everyone as your family. And that's exactly what came up in the Harvard study of 90 years duration, that when you treat everyone as equal and friends, you will live long and live happily. That's exactly what Ayurveda said thousands of years ago. Apto pasevi bhavet arogyam. For good health, treat everyone as your near and dear ones. Don't hate nobody. Hatred is the biggest curse on human health and human longevity. And that's exactly what the Harvard study now says. So what I'm trying to tell you is, the Western studies, when followed for a long time, like the Harvard study, come up with the same data that the Indian studies have shown. Because we have been having this long-term longitudinal studies called longitudinal observation studies, which are the one basis of the Indian wisdom. Whereas the cross-sectional reductionist studies of RCT method in the West is only a short-term study, which can change every day. As a matter of fact, today they say milk is bad. Tomorrow they say milk is good. As a matter of fact, I was reading an article last week which said taking full cream milk will prevent from heart attack. Can you believe that? It came just last week. So this happens because the studies are short. They're cross-sectional studies. When you observe for a long time, like they did the Harvard study for 90 years and the Indian studies for thousands of years, we have come to the same conclusion that food doesn't matter, but the amount of food that you take that matters. And then what matters is how much you eat and how do you eat and how much you like others and how much you love others. So we have the long-term studies of India agree with the longest followed up study in America as far as the longevity and good health is concerned. This goes to show that our ancient wisdom, which we thought as unscientific and which we rejected when we came back here, we thought Western science is the best science. On the contrary, Western science, even Western scientists now think there's a lot of loopholes in Western science. As a matter of fact, the chairman of NICE is National Institute for Clinical Excellence in England, Rollins, his name is Rollins, he was saying that we have given too much of an importance for our cities. They are put a undeservedly high pedestal. That is why our science is going in the wrong direction. So our cities don't take you in the right direction. Long-term studies only take you in the right direction. Long-term studies are aping the Indian studies of yore. So Western science is now slowly thinking of learning from the Indian science. And this applies to what you eat. So friends, don't worry about cholesterol sitting in the table and worry about this or that. Eat what you love to eat, what your ancestors have eaten and what they have enjoyed, but eat in moderation. And have some moderation in everything that you do, not only in eating, everything you must have moderation. And moderation is the key word. And the dangerous word is hatred, what is called hostility. Never hate nobody, because hating does not do you any good. Hating only makes you feel bad. So the Indian food habits are good, and you can continue it even in this country, though you have come and settled down here. It doesn't matter. The food you get now, I see we get all Indian food here. The way it is available in India, maybe in a better form. And so you can rely on our Indian food, because we have been doing that. But don't sit here and say, I will take Mediterranean diet, I will take olive oil. No, all that is for Mediterranean people, not for you. For you, what you are brought up in. We were back home, we were brought up in India, especially in South India, we were brought up on coconut oil for thousands of years. And as a matter of fact, Kerala, people depend only on coconut oil. And Kerala has the lowest heart rate for mortality. A recent study in Kerala showed those westernized Keralites who thought coconut oil has cholesterol, and they stopped taking coconut oil and went into all these funny oils, the oils that are the Western medicine sells. Heart attack rate has started going up, and going back to the original coconut oil, the heart attack rate has started falling. So our food habits and our dietary concepts are probably for all times to come, and our wisdom of all times, because they have been observed for thousands of years, not for 6 months, 5 years or 10 years, but thousands of years of observational study. And observational research in many ways is much better than cross-sectional reductionist scientific research. In reductionist science, you have restrictions. Reductionist science depends on the idea of old idea of the space-time conundrum. But today we have quantum science, which is based on our consciousness. As a matter of fact, there's a nice joke about eating with the hand. This is what I wanted to tell you. I still eat with my hand. I don't use the fork and the spoon. It seems a wise man went to England in the good old days, in the 30s, to pass his ICS. And after passing ICS, they were interned in an English home to learn English methods, because the Englishmen, people wanted Indians to learn their habits. So this man was staying with an old lady who insisted on him eating with the fork and the spoon. One day he told her, "Madam, I use my hand, which I've been using ever since I was born, and I love to use that." Then she said, no, don't use the hand. It's a dirty hand. She said, "No, madam, I washed my hand with soap and water before eating. It's a very clean hand." Then she said, no, look at my fork and spoon. They're cleaned, sterilized. Then he said, "Madam, your fork and spoon have gone into many mouths. My hand has gone only into my mouth. So it's very clean hand, and I'm using the hand. And I even now use the hand." Now we know in Western science also that when you eat with the hand, the bioenergy gets conveyed onto the food that you eat, and food absorption, food assimilation, and food digestion is much better than eating with fork and spoon. So you see the science of our ancient wisdom, which is very good. Unfortunately, we have a holier than thou attitude towards that, and we don't consider that as important. When we come to know the real truth, we will be so shocked to know it's otherwise. That is, our science of yore is more scientific than the Western science of RCTs and reductionism. Reductionism depends on Darwin's theory and Mendel's theory, etc. of evolution. But the holistic theory of evolution is it's the environment that makes us evolve. And there's a lady called Elizabeth Sartoris, who has done a lot of work on environmental evolution. And evolution is environmental, not genetic. And you are what you are because of your environment. You are what you are because you are brought up in your own environment of your parents. Suppose you inherit your parents' disease, it's not because of genes, but because you inherit your parents' good or bad habits. Supposing your parents have been eating bad food and you continue to eat the same bad food, you inherit the diseases that they had. Supposing you don't continue the same habit and same environment, you can change it. So changing the environment, you can change your future. So environment is the evolution and not genes. Now we have come to epigenetics, where the genes also can be changed with your consciousness. In quantum medicine, consciousness matters. And you will be surprised to know that when we deal with others, our consciousness interacts. That is why they have found even in animal studies, when a woman does a study, woman researcher does a study, vis-a-vis a man researcher doing a study, the results could be as different as 30 to 40%. If that were so, our idea of interacting with our own selves and our friends and relatives should also have an influence on our future, on our health, and our longevity. So it all makes sense when you come back and think positively about our past. You will be surprised to know that it is very, very interesting to know that our science is as important, as great, if not more greater, than the Western reductionist science. Only thing is, we have not thought about it. We have not thought seriously about it. We don't respect it, and we don't venerate it. We venerate only the new Western science that we have learned in our schools and colleges. And as a matter of fact, you will be surprised that many of these scientific thinkings in the West are money funded. Now, for example, I was telling you about cholesterol study, Ansel case. Ansel case changed the data by cutting off countries to fit the thing into a positive study only because he wanted to please his funders. And a study by John Ioannidis is a researcher he is a Greek researcher who has done a lot of work, who has shown that our research is so bad and so reductionist that it doesn't really get us the correct answer, the truth. Truth is a rarity, truth is a casualty. And truth takes a longer time to be appreciated because truth is bitter. While, as Churchill very rightly said, while truth still has time to pull up its pants, falsehood and mystery would have done 2 rounds of this world. So that's how falsehood and mystery will go around. Truth will remain back. And Eastern science of yore is the truth. And Western science is only mystery and falsehood. Many times it's not even near the truth. At the same time, Western medicine has done a lot of good, but it requires the help of Eastern wisdom to make it whole for all kinds of seasons, all diseases, and all 3 seasons of the warm summer or hot summer, warm winter, warm spring, and a cold winter. If you want to enjoy all the seasons, you must have a combination of Eastern science and Western science. East is East, West is West, but when they combine together, they are the best. So let us take the best from both, and for future science progress, let's take the best from both the East and the West. Let us not have this holier than thou attitude towards the Eastern science. Eastern science is also good. And mostly the research, longitudinal research studies in Indian studies, very, very good. Thank you very much. My time is up. Now I am available for questions for the next 10 minutes if you want to ask me questions. Questions are welcome. Answers are not guaranteed though.
Any questions, please?
Yeah, Professor, can you hear me?
Yeah.
Right.
Yeah, I can see you.
Right, Professor, it's such an honor to be here. Hearing you speak.
Thank you.
It's amazing. Thank you for the opportunity. I just have a quick small question. Should our food habits be altered based on the geographical location, like in India versus in North America? Right, the weather is so different, and even in India, we have so many different food patterns that you see depending on the climate.
No, the weather
So-
doesn't matter. Weather
Okay.
doesn't matter. As long as you can tolerate that, you better stick to your old Indian habits rather than change them just because you are in this country.
Okay, thank you.
You're welcome.
Any questions?
Thank you, sir. It's an amazing, amazing session, and we are very privileged to have you to spend the time with us and giving this wisdom. And we have always been impressed by your profile. Whenever we wanted to just have any questions or debate on something, we just listen to your videos in YouTube. And thanks for the wisdom that you're sharing, and you're doing amazing service to the humanity here. Thanks a lot.
Thank you, Gomti. Question, Kekale, you have not asked the question.
Yeah, if you don't have any questions, then I will ask you question. Okay.
Yeah.
So, I mean, the root of all the medicines, they go to the southern part of India, and Siddha has a role in the origin of all medicines. So if you look at like in the southern Kerala or Tamil Nadu, we can see the the development of science there, like so much intensive into culture. But so what do you think has happened in the evolution process that we are not, Siddha is not really known by anybody even in India except for like Tamil Nadu or Kerala?
You must remember that anything becomes popular with some help from the government, support from the government. Like, for example, I'll give you an example. You can practice acupuncture in New York legally, but you can't practice Ayurveda in New York legally because acupuncture was supported by the Chinese government and the government supported that. Ayurveda was not supported by the Indian government. As a matter of fact, even up to 70 years of independence, India did not have Indians ruling us. They had British-minded people ruling us. So they didn't support our systems. Only now, in the last 3-4 years, we have the government which is supporting our system. It's because Siddha was not supported by the government, Siddha was not popular. Siddha system, as you rightly said, is very, very good. And it's mainly in Tamil Nadu and Kerala that is known, especially in Tamil Nadu. And the center of Siddha's big evolution is Coimbatore, where a lot of people trying to sort of study Siddha because most of the Siddha literature is in Tamil language. That's another problem. So it can't be universally known because people outside Tamil Nadu don't know the Tamil language. So if Siddha were to be in a common language which Indians understood, Siddha would have been much more popular. And if Siddha were promoted and pampered by government, it would have been much more popular than what it is today. These are the reasons.
Thank you.
One question for you, sir.
Yeah.
How do you see the future of holistic healing? Like in the next 20 years, what do you see? Like you've been researching quite a bit. You've put in a lot of years on this researchers. So what do you feel? What will happen? People will turn back from the modern science. Will they look at our ancient science? Is there a possibility? And how much probability you're thinking from your perspective in the next 20
Okay,
years?
let me analyze your question into two parts. Your first question is very good, which said, what do you think of the holistic medicine for the future? I think the future is for holistic medicine only. But next you came back and said, will they look into our things or Western things? No, that's not a correct thing. Holistic science does not have East-West relationship or East-West division. Holistic science is holistic science. And the future of medicine must be holistic, not reductionistic. And that's the only future. And I foresee all over the world, holistic science will prevail in the future in the next. And that's called healing, timeless healing. And rightly so, there's a book which has just come out, I think in a month's time, it has just come out from Harvard, by Herbert Benson, called Timeless Healing. You see that? It's a beautiful book where he says, the most important part of healing is faith. And this is another very important part that I was telling you, faith healing. You must first have faith in whatever you do. You must faith in the doctor. And that's called the placebo effect. When you have faith in the doctor, Herbert shows in his book how lot of neurological things change in you and the healing starts. So faith in it is very important.
Thanks a lot. It's absolutely true. Like once we have the placebo effect, everything will work. Even our thoughts will work.
Yeah, as a matter of fact, doctors must be placebo doctors. But unfortunately, many of us are nocebo doctors. We create more anxiety in the patient.
That's true. Thank you, sir.
Thank you.
ஐயா வணக்கம். I am Ravi Muthusamy, lives in US. I got a question. I'm a lovely follower of your principle and your advice. I've been reversing all my health issues. I reversed my diabetics about 10 years ago. I don't take any medication, and also I'm follower of Professor Ravindran. He suggested me to take off my thyroid medication last year. I took off and stopped taking. After 11 years, almost 20 years, I stopped thyroid medication.
Okay.
So, and also you have suggested many times, just to throw all the medication, just to be confident on yourself. So still, I took off medication. I feel a lot better last 1 year after removed the thyroid medication. So what do you think? Do I need to, even if I go to doctor, they're threatening me to take medication, and I just skipped the going to doctor. So do I need to follow up with the checkup with the doctor, and what is your
No. You should have a doctor to help you, because every human being must have a family doctor.
Okay.
But choosing the family doctor must be very careful. The doctor must be such that he must be a placebo doctor. Number one. Number two, he must be interested in you. Number three, he must know you and must know your background. Number four, he must know your family background, your economic status, etc., etc. So when such a doctor, if you go, you can always discuss with him. These days doctors have very little time to spend with the patients. But if a good doctor spends time with you, and that's where that's called consultation. Medical consultation is when a man who is ill or imagines he is ill comes to seek that.
Okay, so it's hard to find such a doctor. Always I've been changed 3 to 4 doctors where I live here, but unfortunately, I don't feel confident on them. Everyone, they're trying to put more medication, so that's why I'm a little bit afraid of it. So they're just following their medical procedure, and they're afraid of they're try to give the right advice. They always try to put medication. So I don't know whether that's correct or not.
All right. Well, we'll.
I have one last question. This is Hariharan, if it's okay to ask.
Yeah, go ahead, please. Go ahead,
Dr. Hegde, this is Hariharan.
Could you please ask any general questions instead of therapeutic to your individuals? You can.
No, it's a general question.
Okay.
It's a general question. Dr. Hegde, it's an honor to have an audience with you. Thanks for whatever you are doing. I have watched enough number of videos on YouTube. You are truly an inspiring personality. Thank you for that. My question is related to regeneration. I have seen some videos of yourself explaining how you have helped patients to regenerate their toes and some other maybe fingers or something like that. My question is again, is it possible? Is it possible to regenerate? What does this what does the ancient science say? What is your opinion on that?
Dr. Shan, can you unmute Dr. Hegde, please?
Yes, go ahead, please.
You unmuted me?
I muted you earlier, I think without my knowledge, I think. Okay.
Now I'm all right?
Yes, you're fine. I can hear you.
Okay. No. You see, the doctor is very important. The regeneration happens if you come immediately after an injury, let's say like for example, you cut your finger, within minutes, if you can reach the doctor, we will be able to do that, because it's like, you know, we all have the capacity. You see, you have your you know, these things on the if you cut its tail, it will regrow. So if you cut your finger also, you can regrow. Only thing is difference is that you require something to stimulate the cells at the end of the cut end, and you require something to prevent an infection. What we do is, as soon as we see this, we cover that with silver water. Silver water is a very good antiseptic, so it doesn't allow any infection to come there. Then we stimulate the cells at the tip to convert their polarity from negativity outside inside and positivity outside, reverse it. Then the cell starts growing, and you can grow it. Actually, I've shown one police constable whose whole foot was gone because of diabetes, and almost half the foot was gone. We were able to get the foot back to normal, and he is normally walking now. He's very happy about it. But that is very difficult. You have to sit with them for months together. It's not 1 or 2 days you can do it. And people say, I have cut my finger last month, can you regrow it? Impossible. If you can come immediately after the cut, we can try and do something.
Okay. Well, the last question, Doctor. This was probably a student, Anirudh Jail. If I have to begin studying medicine formally today in the year 2018, knowing that the ideal would be an integration of traditional medicine along with modern medicine, what would you suggest?
You know, I have a suggestion. I have written an article for you. Do you want to be a doctor? Think before you jump. If you get hold of that in the internet, read that. But there are other things that I want to tell you, that we have said, you know, in the future, you will have to have an idea of both Western medicine and Eastern medicine. Western medicine you must study because you go through a systematic study of the modern medicine. Once you finish your MBBS, it will be nice to have a diploma in Ayurveda. In addition to that, instead of a MD or something like that, Western medicine, you can have an Ayurvedic degree. So you will be an ideal future doctor for holistic healing.
Thank you.
Thank you
so much. Okay, real quick, please.
Yeah. First of all, thank you, Doctor, for sharing your views and the effort that you're putting into help the society. So my question is about, as you mentioned, like irrespective of the geographical location, like we continue to eat the same food. But if you see most of the Indians who move to America, like they have the vitamin D deficiency. And one of the major reasons what the doctor is saying is like we have a very dark skin. At the same time, like during the winter, we all cover ourselves very well, so we don't get exposed to the sunlight. So unlike India, like we don't sweat out here. At the same time, we do apply a lot of moisturizing creams during the winter. So what is your advice to follow based on your experience to help this kind of?
If you went for a test, even in India, your vitamin D levels are very low.
Yes.
Whoever went for a test has a low level.
Yeah.
Anyway, but all the same, what I'm saying is, if your level is low, then take vitamin D supplements. There's no harm in it.
Okay. So how long we can take?
Don't take vitamin D unnecessarily, and too much of vitamin D is bad, because there's a disease called hypervitaminosis D, which is much more dangerous than cancer.
Okay.
So be careful.
How long we can take the supplement, doctor?
No, as long as the levels are low.
Okay.
But I would also expose myself to sun and get some, you know, real vitamin D3 from the sun directly.
Okay. Thank you.
Anyway,
Doctor, again you are muted.
Yeah, I think so. Give me a second. Doctor, give me a second. Yeah, go ahead, please. Yes, go ahead, Doctor.
yeah, actually, I have answered the question.
Okay, well, we lost it. The last bit, was
I said go in the sun as much as you can
okay. Okay.
and have as little less clothes as possible, because that's the fashion here. I see a lot of people going without shirt on the bicycle.
Mhm.
That's good for them. So you can also do that. You ape so many bad things, but why can't you ape some good things?
Mhm. Okay. Thank you so much, Dr. Hegde. It was like really an eye-opener for all the community from India who just traveled here. They don't know what to do. They're all confused desis, we call them. They don't know what to feed their babies with, what to eat, what doctor to see. And
Pleasure was entirely mine.
right. So,
and I have one advice: they should feed their babies with their own milk.
yeah.
It's a wonderful thing. The human breast produces milk depending on the age of the baby. If you analyze the milk at the birth of the baby and analyze the milk at the 7th month of the baby, the contents are totally different. So as the baby needs more protein or whatever, the breast milk produces that. So it's a fantastic machine, this human machine. I don't know whoever made it, God or people don't believe in God. Nature made it. Nature is a fantastic scientist and much better than most of our reductionist scientists.
Okay. Thank you so much. And we'll close now, because our time is already it took 20 minutes. So it was excellent, doctor. We will definitely, doctor will be available even in the future. He said he's going to see we can discuss something, that any course or something may be possible in the future. So he will let us know. So it's not, like an education that he can offer to everyone, an extended version. So thank you, doctor. So Siddha-Vetha Center is trying to bridge the gap between the ancient wisdom and modern science, and that's our real goal. So we are offering many courses in Siddha-Vetha, where one of the courses, Transdisciplinary Science and Technology, which gives an introduction to all the ancient science courses. Then we open the Varma course and the course on Siddha. Yet to come, the courses is pain management. So pain management is one major area. So we are opening the pain management in late November. And in January, we are ancient agriculture and palmistry will be opened in the January spring 2019. So we are trying to bring as many courses as possible, and all your support is very important. So next week, a bunch of people will share their wisdom after taking the courses, their transformations. So you all, it's like a chat session, so you all can join and enjoy that session. And after following that, we will have a couple of speakers, world-renowned speakers that will come and give a talk. So today was a wonderful eye-opening session by Dr. Hegde. Thank you for your time.
As I said, pleasure was mine.
Yeah,
Thank
thank
you.
you, doctor. Thank you, Sean.
Thank you.
Thank you.
Thank you, doctor.
Thank you.